Hello, everyone. My name is Solome Tibabu, the host of the Expanding Access podcast. And today, really looking forward to talking about how to expand access for behavioral health supports for the veteran community, and thrilled to have our special guest, John, here today with us. And before we get into a robust conversation, it would be wonderful if you could start off by just introducing yourself, please.
Yeah, well, howdy. It's good to be with you all today, and thanks for having me. My name is John Boerstler, and I'm currently the head of our public sector here at Ipsos Public Affairs, and excited to talk about veteran access today.
And John, how did you get into this field? And maybe you could tell our audience what connects you to this population a little bit.
Oh, sure. Well, I am a veteran as well. So I served in the United States Marine Corps in the late 90s and early to mid 2000s, where I served a couple of deployments overseas and got a little banged up like a lot of us do, and needed to navigate the benefits and care system that the VA so expertly provides all of us. And as soon as I finished my service in the Marine Corps, I wanted to continue to serve my country in other ways. So I went and worked as a congressional staffer immediately following my service in uniform. Then I went home to Houston to work for two mayors of Houston to help them kind of coordinate their returning veteran, Iraq and Afghanistan veteran strategy, since we were seeing so many people come back to Houston, Texas, and the region for jobs mainly, but great housing and great culture, great food, of course. And then I continued my career in the private sector, where I got a really great opportunity to learn a little bit about marketing and sales and business development in the energy business, and then helped bring together a lot of skills and experience to get essentially pipeline more military into heavy industry careers. So like energy, construction, manufacturing jobs, by leading a recruiting firm on behalf of the energy sector. And then found my way into technology and developing technology to help veterans navigate all the resources that they need in order to make a successful transition from military to civilian life. And we built this system and then started deploying it to state government agencies so that they could then use it at scale for veterans, high veteran population states and communities. And that's what led me to my service at VA, where I served almost 4 years as the Chief Veterans Experience Officer, where I had an incredible opportunity to serve again outside of uniform and lead the Veterans Experience Office here in Washington, D.C. before my current role at Ipsos Public Affairs. So thanks again for, inviting me to talk a little bit about this important topic for many different reasons, not the least of which is incredibly important to me since I get all of my care at VA. So.
Wow, just amazing. Thank you for your service in so many ways. What an incredible background that includes military service, leading customer experience at the VA, and now working in the private sector. Because you're so well connected with the veteran community, what would you say is the one thing you really wish people knew about what veterans need when it comes to behavioral or mental health services?
Yeah, I think in general, the American population and many other populations around the world, there is this stigma around accessing and navigating mental health resources that are available to people. And I think as the more we can do to normalize accessing these incredible resources and care, especially for veterans and their families who have endured so much trauma in their service, I think it's incredibly important. So in my role at VA in particular, we worked directly with our Office of Suicide Prevention and Office of Mental Health to ensure that we really designed better pathways into access mental health care by getting the word out about these services, destigmatizing them, like developing marketing materials that had personas of different types of veterans that resonated with the customer, and did quite a bit to engage essentially the system around veterans. So their social network, the ecosystem, their family unit, their friends, their coworkers, anyone in their kind of extended network, with the National Buddy Check Week campaign that we launched while we were there. And that was really to encourage folks to check in on their buddy and to refer veterans in for care if they needed it, especially for mental health care. So it's an incredibly important piece of what VA does every day. And a lot of the nonprofit organizations that work alongside of VA is to really ensure that experience is world class, but also destigmatized in as best a way we can. And we can use design, we can use customer experience insights to help ensure that that message gets delivered.
Yes, stigma is so powerful, and it just really requires innovative strategies like the ones you just mentioned. Really great. Speaking of innovation, I understand that a couple months ago, you worked with Luminary Labs about who veterans are and where they're receiving care. And lots of innovators and healthcare providers have misconceptions about veterans. Can you talk a little bit about what are some of those assumptions and how can we as the innovation community avoid them?
Yeah, I think there's a lot of different insights that can be gleaned from our direct care system and our community care system for veterans that are accessing healthcare, either using their own private health insurance provided by their employer or their spouse's employer, or through the VA care system, whether that be through community care or through the direct care system. And the more we can do to better educate providers and staff about the nuances of what veteran care needs in terms of cultural competency and kind of understanding, the different types of injuries and the different types of trauma that folks may be exposed to, traumatic brain injury versus CTE, these types of nuances. I think we have we always have more work to do in that endeavor. And I do think by studying employee experience in particular, both in the healthcare setting, in the VA healthcare setting and outside the VA healthcare setting, we can really learn a lot more. And I think drive toward a lot deeper insights so that we can not only understand the challenges that some of these clinical providers have in both systems, both the American healthcare system and the VA healthcare system, in helping veterans and their families, but really helping design new training and opportunities and tools for them to use so that they are delivering a world-class experience. They are delivering that world-class healthcare that veterans so rightfully deserve. So we did a tremendous amount of work while I was at VA. And I think that work continues to essentially kind of connect in with the broader American healthcare system, because so many doctors in particular are trained by VA. And I think the percentage is still in the majority of doctors are trained at some point in their career through a VA healthcare system, because all 160 VA healthcare systems are typically located or partnered with a medical school. So lots to always do to improve that, but there's already an incredible foundation that has been created with the VA healthcare ecosystem since the beginning, since General Bradley stood up the system right after World War II.
That is just, I wonder if our audience knows just how expansive that is. Really amazing. And related, I was excited to see that Ipsos conducted this follow-up survey examining veterans' opinions related to getting mental health care specifically. What data points really surprised you from that takeaway?
Yeah, and if I can remember correctly, because I do think the article's being published, so I don't want to jump the gun and release too much of the information, because I think it's important to read. I do know that, veterans in particular still do need that help and outreach to encourage them to seek care. But a lot of the proactive access channels that have been created to reach so many veterans, as I mentioned before, have really helped improve the way that folks are getting that care. For example, we not only kind of built a mechanism when surveying veterans through our V-Signals program at VA to identify potential mental health crisis using the free text comments that they would leave in the surveys. So if you can think of things that somebody might say in a free text comment, which could be, a call for help, the machine learning would be able to identify those terms after doing a lot of testing and a lot of reducing the false positives down as much as we could. It would essentially trigger in the system and then notify the veteran crisis line that they would then proactively reach out and wrap their arms around that veteran if they were in mental health or housing crisis. So there's a lot of mechanisms built into the journey to ensure that they don't fall through the cracks, that we don't fall through the cracks collectively. But I do think that there has been an improvement in the way that veterans overall perceive the way that mental health care and healthcare is delivered by VA. We just did another study that is coming out. It's going to be public probably sooner than this article, which is great. That shows, that validates a lot of the trust between veterans and the VA healthcare system has not only steadily risen over the last 10 years, but still maintains. And I think it's important to continue to monitor that and understand what those challenges and what those pain points are in accessing mental health care could be and are in reality. So the study that we did, you can see some of the nuances around what veterans think. And I think that those insights do help us plan and do help us deliver that care more effectively.
Can't wait to share out these links with our audience to check out for themselves. But one thing I noticed from that survey was that it had also found that veterans believe their peers are more likely to seek care only during a crisis situation, as opposed to, say, transitions or preventative care, irregular maintenance. And in behavioral health care, we know that early intervention is so critical. What can we be doing to help encourage a shift from crisis response to prevention when it comes to veteran populations?
Yeah, it's all about a well system versus a sick system, right? And preventing as far upstream as you can in that journey. We do know from a lot of the data that's been collected through the VA and elsewhere, including Ipsos, that a lot of mental health crisis is created by financial insecurity. So how might we design better ways for veterans to access health-related social needs, like, for example, employment services? If that's a predetermining factor to financial insecurity, then how can we address that much further upstream before they get to that crisis moment or series of crisis moments leading up to crisis? How can we address food insecurity? How can we address housing insecurity or legal challenges that they may have by plugging them into legal services? I think this broader, social drivers of health movement is something that VA is thinking very hard about, and I think continues to think very hard about. And the more we can do to address the gaps that we know, those pain points that we know exist in the journey, the better off we can to help them seek care. But, things like Buddy Check Week, to your point about, the friend, nuance and the friend insights, I do think is an important program to get more veterans really engaged and get them more comfortable with seeking that proactive care, to your point. So we do always have more work to do. And I think that the data, like when we look at the overarching crisis data for veterans, it only tells one part of the story. So how do we design better nuances? And I do think that VA, what we started last year before I left, we're really taking a step back and remapping that mental health care journey so that we can, especially on the outpatient side, but to your point, it really helps, I think, prevent any future crisis if they are proactively seeking outpatient mental health care leading up to, potential crisis. And so how do we smooth out those pain points more effectively? And that's something that VA continues to study and should be sharing, hopefully publicly soon.
That's all really great work. And John, here at the Expanding Access podcast at Behavioral Health Tech, we're, of course, very excited about the opportunity for technology to enhance and expand access to behavioral health support. I also know the survey had asked about technologies and tools like wearables, peer support apps, even AI chatbots. What did you find out, and what do you think innovators creating these types of tools for veterans should be considering more?
Yeah, and this is something that the Office of Health Innovation and Learning at the Veterans Health Administration does quite well, as you all probably know. And if you haven't heard of them before, check them out. Office of Health Innovation and Learning. It's the VA innovation ecosystem. We've collaborated on a number of studies ranging from what do wearables look like for not only veteran physical fitness, but monitoring potential crisis points and the way that our Whoop bands, for example, may measure intense stress and breathing and the oxygen levels, et cetera. I think that's important. It's an important channel that we should integrate, that we should consider as part of the care plan, but also part of the care monitoring for primary care physicians and mental health professionals and maybe even social work. But in more tactical experiences, what I did before I came to VA, as I alluded to at the beginning, was at Combined Arms, we built this system that essentially helps veterans navigate a lot of those resources, both mental health, direct health care, as well as all the health related social needs that I kind of referred to as the pain points in seeking care. So, because if you have transportation insecurity, you can't get to your appointment, then that causes a problem. If you don't have broadband or Wi-Fi to do a telehealth appointment, then that's a barrier to care, right? So how do we address those issues in addition to like the food insecurity and the employment services and the legal services to really ensure that veterans are more successful, like further upstream, like I said, in that journey? And so by designing that system, using the veteran experience, using their user and customer experience insights, we were able to really solve for that. And we partnered with the Bush Institute down in Dallas, and they launched this Veteran Wellness Alliance, of which the VA was a key partner early on when developing this. But essentially, it was like a coalition of nonprofit organizations and government agencies from across the board that came together to address this issue head on. And they used the Combined Arms platform that they rebranded as Check, which is similar to Buddy Check, but it's a separate app. So you go in and you're able to identify yourself as a veteran and what services you may or may not need. And based on a lot of that data, we can do a lot of predictive learning and analytics about individual personas and then start recommending different services. So I do think that increased access to mental health in particular, leveraging technology, and for thousands of veterans, and still continues to do so today within the coalition. But things like that, like broad-based advocacy and policy advocacy coalitions and policy networks that are set up to really address this challenge of accessing mental health services in particular, really do need to be fully supported at scale. So those are just a couple of examples of like leveraging technology as a tool, but like complementing the pain points, like solving for the pain points in that journey, and helping increasing that access to mental health care and broader health care more specifically.
You said it wonderfully. Technology is enabling and expanding on just so many great examples that you've shared. And the VA has pioneered so many technologies that now consumers are using everywhere. It's very exciting. And you and your team have spent so much time surveying veterans to see what their perceptions are. It's just such a powerful lesson for our audience, building for any community, frankly. How can we create solutions without understanding the populations we're looking to serve and having them right at the table? So such a great takeaway for everyone in our audience. But if I could ask you one more question, John, what if you had the opportunity to survey the behavioral health tech community? What's the one thing you would really want to ask them?
That's a great question. As someone who has been involved in the behavioral health tech community as a means of increasing access in my prior life, and then, of course, being exposed to a lot of different tools at VA, I would ask them what they think things like AI will help us do better, do faster, more efficiently, how we can leverage these models to ensure less veterans fall through the cracks by helping more access mental health care in particular, whether that's VA, private health care, or nonprofit provided in the ecosystem. I think we should create all menu options, provide all menu options instead of just one or two based on eligibility. So I'd love to see kind of what they're thinking in terms of how we can leverage these tools to better drive access, especially if we're thinking about AI or extended reality, which is something that we worked on also at VA, and improving patient experience, which is another kind of entree into accessing mental health services how do we better train staff and use extended reality, virtual reality to do that as well? So I would love to see AI and virtual reality. Like, how does that create more community? How does that help veterans access this important care more effectively?
Well, that is a great call to action for the innovators and developers in the BHT community, and just such a delight to learn all of this amazing work. Thank you, John, for all you do and your team has done, and the exciting work with Luminary Labs as well.
Thanks for having me. This is great. Appreciate it.